参会代表、各位专家，大家好，我是来自广东省深圳市第三人民医院艾滋病。
Distinguished guests, my name is Wang Hui. I come from the Third People's Hospital of Shenzhen, AIDS Medical Center. Today, I'm going to share with you the challenge of translating PrEP and PEP from research to practice in China. I'd like to address the issue from two perspectives. First of all, I'd like to show you the HIV epidemiology in China. By 2020, by the end of 2020, we have about 1 million people living with HIV/AIDS, and with some 351,000 cases of deaths being reported. In 2020, there were 131,000 new reported cases. So it looks that the trend is going down, but the absolute number is still very huge. And you can see that the 97.5% of the HIV/AIDS in China were transmitted with some sexual transmission, and 74% by heterosexual transmission, 23.3% homosexual transmission. So in the big cities, you can see the homosexual transmission percentages are very high, even up to 60% in some of the cities. So the 23.3% by homosexual transmission is the average rate. You can see this is the epidemiology in the Asia-Pacific region. You can see that the homosexual transmission or MSM transmission rate was much higher than the global rate. So that's why we have to pay huge attention to the MSM population. I'd like to review the prevention and intervention strategies. Therefore, we stressed the importance of behavioral intervention. And now, we would like to introduce more interventions, for example, biology or biomedical interventions. So in the category of biomedical interventions, you can see that our focus was on post-exposure prophylaxis and pre-exposure prophylaxis. So this is the focus in the biomedical prevention or intervention. And for the maternal prevention, China has a very high rate of providing the for this group of population. So here you can see that the focus will be the PrEP and the PEP. So you can see this is the study in China, the effectiveness and adherence of PrEP in China. So you can see that one intervention is a kind of a daily intervention, a regular daily intervention. Another intervention is event-driven exposure prophylaxis. So the population is the MSM population. We would like to compare the difference between the two modalities of prevention. So you can see this study lasted from 2018 to 2020. The subjects are the at-risk MSM population, and they are entitled to select the preventive actions with their own wish. So half of them choose daily PrEP, and about 50 of them choose event-driven PrEP. So you can see that the drug include Truvada, which is a TDF-based regimen, and also we have another group of control group. They are the high-risk MSM. They are not willing to initiate a PrEP. However, we will follow up that control group as well. And we covered the sites in Shenzhen, Shenyang, Beijing, and Chongqing. The follow-up duration was 12 months, and the follow-up time point include months 1 to month 1, 3, 6, 9, and 12 months. And we have enrolled 1,222 MSM subjects. So this group of MSM subjects were willing to initiate PrEP. And in the end, 1,023 subjects were eligible cases, and 520 subjects chose daily regimen, and 503 subjects choose event-driven regimen. So here you can see that in the daily regimen group, 5 cases had HIV seroconversion, and in the event-driven regimen group, 2 cases had HIV seroconversion. And in the control group, which is a negative control, that means they will not receive any PrEP medication. You can see that among the 507 eligible cases in the negative control group, you can see there are 28 HIV seroconversion cases. So this is roughly the result of that study. You can see that in the medication group, you can see that regardless of the group, you can see that they have young age and they have high risk of transmission. That coincides with the overall situation of the MSM population. You can see that if the subjects use PrEP, regardless of the 2 interventions, both of the 2 groups have a very good protection. The average protection rate is 87%. And after the after the adjustment for adherence, the protection rate is 100%. And in this study, we have also observed, and you can see this is on the comparison between the 2 groups, daily and the event-driven. You can see that the event-driven group have a change of the adherence. However, the adherence of the daily group is always stable. So that's why we like to say that the daily dosing is a kind of a more stable way, more steady way of providing robust prevention outcome. And based on this study, the PrEP indication of Truvada was approved in China. And now China has also issued our own guidance on PrEP. So after the project is completed, what happened to this group of patients? So we did a further study. We conducted a questionnaire surveillance. You can see that 600 subjects from the medication group come back for follow-up and answered our questionnaire. And also a group of subjects from the negative control group also come back for follow-up. Sorry, the voice of the speaker is very much stuck in the internet. Now the translator could not hear a complete sentence. You can see this is the result of the surveillance. Only 1/3 of the subjects would like to pay by themselves to cover the cost of the PrEP. And you can see this the types of PrEP. And you can see that most of them use generic drugs, and also some of them use Truvada. And for the laboratory test, you can see that most of them would like to receive, the HIV testing. However, a lot of those subjects in the study do not have a regular testing for their liver function. So that's why we still need to encourage or advocate the subjects receiving PrEP to run regular testing for their kidney and liver function and other general condition tests, not only HIV test, but also other general condition tests. And this is the current status of the pre-exposure prophylaxis in China. And it looks that the awareness or the understanding of a PrEP is not so good in China. So in the future, we should, have a good cooperation between clinicians, CDCs, and the other societies to further advance the PrEP. And now, let me change the gear to PEP. For PEP, you can see that we started the same project, very similar time point to PrEP. You can see that we had a pilot project in Tianjin. So we started from the pilot sites, and in 2020, China issued a PEP guideline. So according to the guideline, it is the best to take the PEP drug within 2 hours after the exposure, no later than the 72 hours. So this is the list of the PEP medication. So you can see that TDF, 3TC, or FTC, and with some the integrase inhibitor. This is the most recommended regimen for PEP. The current status of PEP is that a lot of hospitals do provide the PEP service for patients, for their clients, but the standardization is a problem. And also there are some, workflow which are not standardized yet. And also we identified a phenomenon that is among the subjects seeking service of PEP in our hospital. Actually, they found us, with some the information from the booklets or from the promotion materials. So actually, we don't know if we have covered the most important high-risk population, which is MSM population.
Therefore, we did a study in Shenzhen, that is South China. Shenzhen features a population of around 20,000 of MSM, that is the cohort under the surveillance of CDC. So we want to learn whether the PEP seekers were indeed the MSM registered. And we found only 63 of the PEP seekers were from the MSM cohort in the CDC system. Therefore, we ponder whether the high-risk population have access to information and resources of PEP. Therefore, we use questionnaire to look into that question. It turned out that the MSM population learned about PEP and their awareness is increasing. However, they do not go to the clinic, so they may buy medicines from online shopping for their own PEP use. Also, we found that PEP users of MSM has more sexual acts uncovered by a condom. Therefore, they still constitute a high-risk population in HIV transmission. So we need to boost up our efforts in fighting prevention among this high-risk population. To sum up, I share the new infections in China. They are mainly driven by MSM. They are still the key population in China. In terms of strategies, PEP and PEP are important, and we are launching more activities and efforts in these two areas. And we are faced with many challenges in PrEP and PEP. We would find resources and solutions to those challenges. That's all for my presentation. Thank you.